Is wound care your weak link to inspections? In this short video, you will find out all the things that you need to pay attention to and that you need to do during inspections so that way wound care can be your strong link. Hi, I'm Dr. Kacian Brown. I'm a board-certified wound care specialist that has taken care of thousands of wounds over the course of 10 years. And I am going to teach you all the secrets that you need to know so that way you can be strong when it comes to your inspections. Now, let's explain how this works. So when state comes in for inspections for wound care, they're looking for certain criteria to be met. For example, they're going to pay attention to glove change. They're going to pay attention to the wound care that is done at the bedside. They're going to pay attention to the wound care cart to make sure that the right products are on the cart with the right patient's name that is on that product. They're going to pay attention to the facility having what the wound care provider has ordered, right? Not only that, did you know they're going to pay attention to the room setup that the patient has? So let's go into it. Let's talk about the wound setup first. Number one, prior to your inspection with state, your wound care team, your nurse, your facility providers, like, your techs, they need to go into the patient's room and make sure it is clean and tidy. For example, there should be no medication in the drawers. Absolutely not. Nothing that was dispensed from pharmacy should be in the patient's drawer unless they have a specified order from a physician or a provider to say they can keep it bedside. Number two, is the patient's room disheveled? Like, are the sheets on the bed? Are the sheets dirty? Are they clean? Is the trash can full and overflowing? The room needs to be inspected by the facility staff and it needs to be in tip-top shape prior to an inspection. Number two, let's go ahead and talk about the medications on the wound care cart, right? Or the creams, etc. Every medicine that is on that wound care cart needs to be assigned to a patient, and it needs to be a current order, and it needs to be up to date. So prior to your inspection, absolutely. And actually, throughout the course of your entire facility's existence, you need to keep up with that wound care cart. You need to go through the cart, patients who have left, meds that have expired, orders that are no longer active. All of that needs to be cleaned up prior to your inspection. Most facilities do that on a very regular basis. But in the event you're having your inspection, this is the right time to go in and make sure that is in tip-top shape. Number three, glove changing and hand washing. You cannot do that enough. Your wound care team, your wound care nurse cannot do that enough during inspection. What they're looking for is that you don't contaminate the wound, right? So what do I mean contamination? Can you touch the wound and then go touch the pipe faucet with the same glove and come back and touch the wound? Absolutely not. You can't do that. It is going to contaminate the wound. You don't know what kind of germs is on that pipe faucet. Lord knows what kind of germs is on that pipe faucet, right? So that would be the opportunity. If you're touching a patient, you cannot really go and touch anything else. When you're doing patient care, you need to be focused on patient care. So let's talk about the procedure. You have to go ahead, you gotta wash your hand or sanitize your hand. And then you have to dry your hand, then you don your gloves. Then you go and you touch a patient, you may touch the wound. Once you touch the wound and you remove the dressing, guess what? That dressing is dirty. It's been on for 24 hours, 48 hours, 72 hours. Did you know we carry bacteria on our skin and in our wounds without it being infected? We're natural habitations for bacteria. So yes, that bacteria has been sitting there in that dressing all that time. When you go and touch it, yeah, you've contaminated your gloves. So once you remove the dressing, this is the opportunity for you to deglove, throw the dirty dressing and the gloves in the wound. You go, you wash up, you get clean again, and you re-don your gloves. And then you proceed with your wound care. So these are some of the things that state is looking for on inspection. And these are some of the things that you need to know when you're going through inspection, because you don't want inspection to be your weak link. I trust that you have learned something from this video. So go ahead and put the word strong in the comments below. So that way you can partner with House Call MDs and become a strong link when it comes to state inspections.